at home. You look at me with doubt. I think your mummy's a good cook. Shall we give her a challenge? नहीं? Try करेंगे? Try किया आपने? What else can I do? Oh, you like biryani now? That is delicious. It's my favorite. Veg biryani. Okay. So, does mommy make that for you? No. But then we have to find out if mommy can make nice biryani. I think she can. Do you like any chicken in your biryani? Do you eat chicken? No? Okay. But you eat veg, yeah? Very good. And have you tried tofu? You know tofu? No? Have you tried soya? Get more thirsty. Okay? And when they get more thirsty, I have known children who will drink when they're brushing their teeth, they drink more water. When you know that, yeah? When they're having a shower, they drink. आप समझते हैं? शावर में नहाने के टाइम भी ज़्यादा पानी पीते हैं. कोई बच्चे लोग स्विमिंग करते हैं, वो पानी पीते हैं. कोई बच्चे, एक बच्चे ने इस्त्री में से आयरन में से पानी पिया है. वो इतने डेस्परेट हो जाते हैं. अभी एक सीक्रेट है, आपको कम पानी पीने के वास्ते आपको क्या बंद करना है, कम करना है. कम पानी पीने के वास्ते आप कम नमक खाएंगे तो कम प्यास लगेगी और कम पानी पिएंगे. ओके? तो इसलिए सॉल्ट कम करने के वास्ते आपके मम्मी डैडी को हमने समझाया है कैसे हर बार वो घर का खाना है और थोड़ा थोड़ा सा कम करेंगे तो कुछ ही हफ्ते में आप सॉल्ट की के लिए क्रेविंग नहीं होगी. It's just, if you can explain, we all have taste buds. And the salt taste buds, exactly as Meenakshi said, it takes about 3 to 4 weeks for those salt buds to wind down. The more salt you eat, the more the salt buds will proliferate, they will grow, and the more salt you want. So you get trapped in a vicious cycle. You eat more, you want more, you want more, you eat more. It goes on and on. If bit by bit you cut down, and it's important for all of us, and all of us need to cut our salt intake down. In 3 to 4 weeks, you will automatically lower that need for salt. Yeah? And the minute you lower salt, you will lower food. It's impossible to control food without controlling salt. Yeah? Okay. Or any questions?
Actually, they feel very thirsty. My son especially, his lips get dry and he feels thirsty as he doesn't like sweet things. He wants spicy, salty. Still, I give him less amount of salt, but still he feels thirsty. So there is a tendency of stealing water from the kitchen, which I have been facing. So due to that, his gain is becoming more and more. So this is the difficulty.
Like his ice cube in his mouth, maybe it helps. But as a whole, I would just request the doctors as a dietitian, because what happens here that we are running all the time. Maybe sometimes we are going to this patient, sometimes to that patient. We don't have at all any time. So this is my request to the doctors, if they can arrange sometimes a patient awareness program, that will create much help, I feel. Because we tell the children that don't take this, don't take that. This is just like instructions we are giving. But I think the parents must be counseled first, and not only the parent, the other family members. Because it happens that I have personally, I had a patient that his mothers used to say that, ma'am, I am trying to give my patient, trying to give my daughter whatever you are telling. But what happens whenever her grandparents are coming, they are telling me that you are torturing our grandchildren. So I think the whole family should understand what the mother and the child is going through. Unless and until we can teach all the family members that this is for the benefit of the children of the family. I think it will be really a hard task for the dietitians, because we get time to talk with them hardly half an hour, maybe. Yes. Yes, and it should come from your side, ma'am, from the doctors. Otherwise, people are not ever that they will come to the dietitians of their own, because always they find that doctor can tell me everything. We are paying to the doctor. Again, why should we go to the dietitian? It's an extra burden. This is a fact. So if it comes from your side, then they will understand. No, this is actually required. This is my feeling.
Sit together and then counseling is more effective than the separately counseling. But that's not happening.
Race, really, and maybe I know every time it's impossible, but the hemodialysis patients are there 3 times a week, right? So at least maybe once a month or once every 2 or 3 months, you can do a joint doctor-dietitian round, maybe. So you can't change the whole world in one day. We can't grow our dietitians, but we can use your time more efficiently. And then, as you said, it's difficult to find time for a dialysis family to go and see a dietitian. But maybe if you make face-to-face contact once, then your follow-up can be on a Zoom call. Yeah, and a Zoom call or a WhatsApp video call. So all of us use WhatsApp. WhatsApp video call is easy.